Welcome to this video as always, and I'm going to jump straight in today with some data from the United States, and this is related to the number of COVID-19 patients actually in hospital. And we see the three peaks from the United States here. So with the original one March, peaking in March, then another one peaking in August, but we notice that the current one is the highest of all. Now, the thing to notice about these first two peaks is they were fairly narrow. They were peaks, they were just peaks, they were just that. The data at the moment, in terms of number of patients getting infected, indicates that this may not just be a peak. It may carry on rising and potentially plateau, which is a concerning. So we are actually at the critical point of this pandemic now, and it's just so ironic because we're only a couple of months away from fairly wide scale vaccination, which so nearly made it without this, what we could call the third peak in the United States, which is going to be, I'm afraid, I think is going to be the worst of all. So that's the graphic. It's the highest it's been ever in terms of inpatient hospital patients, and we don't know if it's going to go up and how long it's going to stay high for. Is it going to be an arc like that? Of course, we hope that it's going to go dramatically down again, but it may well not, based on the number of new cases that are being diagnosed and the percentage of those cases which are positive, indicating the degrees of community transmission in the United States. Now, that's the figure for hospital admissions. Now, if we look at the figure for intensive care, we're not good, but we're not where we were. So higher than the second peak, but not yet as high as the first. But it's inevitable, absolutely inevitable, that some of these patients that are hospitalised now are going to get better, of course, but some are going to deteriorate and require intensive care. So it's just so frustrating. We were so close to making it because the vaccines are coming. There's no question about that. More on that in a minute. But we've got this to get over first, and this is going up, and it's going up steeply. And I will be giving some advice, and if that advice is followed, this will be greatly mitigated. It's not my advice; I'm getting it from the CDC. But more on that later on. So just to summarise this, these are the references for those graphics. Do check on them yourselves. Official hospitalisations in the UK, in the United States. Sorry, you can check on that there. This reference is it's fairly good, but I'm not going to bother putting it up because it's always so out of date. This data is much more current. The official data is always several weeks lagging. More than double the number of September hospitalisations, all-time high. 15th of April was the previous record, if you want to put it like that, but this is higher than that. This figure actually is this is more than 24 hours old now, so that's a bit out of date now. The numbers are fairly significant, now above 61,000. Cases are increasing. So the reason that we know that hospital cases are going to increase, this is going to increase. We know this. And the reason we know it is because of the number of new cases that are being diagnosed. One day there's 139,000. Now that's unusual, but it's the highest it's been for a single day figure. The average for the past week has been 111,000 new cases per day. Over 1 million new cases in the first 10 days of November. Now this is going to feed through into hospitalisations, inevitably. Interestingly, we have hospitalisations from other countries here. I mean, of course, we're not comparing these. These are completely separate because of the much larger population of the United States, of course. But still interesting to note hospitalisations are going up quite dramatically in France and Italy. And indeed, in France and Italy, we see that the per capita number of patients in hospital is actually is actually, so there's 30,000 patients in hospital in France and Italy, but the population of the United States is what, four or five times those countries, about 4 times those countries, maybe 5. So the United States is still lower per capita, but the direction is bad. So France, Italy, high per capita. The United Kingdom also increasing quite a lot as well. So yeah, that's where we're at with that. April and July peaks were short-lived, which is the main point. This one may be a plateau. We don't know yet. The number of cases indicate that rather than just going up and going down like it did before, the cases could go up and could potentially stay up for a period of time, depending on behaviour and things like the mask wearing, which we're going to look at. And deaths in the United States, of course, inevitably grinding up the way. This is the new site I've been looking at, COVID Tracker Project. Not that transparent data, but do feel free to look at it if you would like to. Now, I'm not going to flick onto the CDC data again. You can click on that. It's on the website. We've looked at this quite a few times. But cases are going up in many states. Again, particularly in the North and the Midwest states. Now, that was a bit depressing, but let's go on to some better news. Moderna, National Institute of Health vaccine, part of Operation Warp Speed, of course, have said the first results should be out soon. And I would imagine that probably means days to a week probably at the most. Basically, they're just waiting for people to get sick to catch the infection. And then it will demonstrate that there's more people in the placebo group catching the infection than in the experimental group catching the infection. We're almost certain. The case is what the difference will be. And we know it's a 90% difference in the case of the Pfizer. So more vaccines are coming out. The interim data, well, we haven't got interim data. This will be interim data. But the phase 2 data on that indicates it is going to work. And the fact that the trial is carrying on indicates that it appears to be safe so far, or as safe as any vaccine can be. So that's encouraging. They're coming out soon. Now, again, the United Kingdom, lab confirmed cases, significant increase in the number of new cases. Deaths continue to increase. They're the deaths of patients who've died within 28 days of a positive diagnosis. These are the number of deaths from the 3 statistical agencies, which are, of course, England and Wales, Scotland, and Northern Ireland. So it's giving a total of basically 66,000 deaths in the UK. Now, these appear to be higher than the deaths in Italy and France. But because countries collect data in different ways, they're basically not directly comparable. And again, I'm not going to go on it today. We've done it quite a few times. But go onto the COVID Symptom Tracker app. And what we see is the total number of symptomatic people is actually starting to decline, according to the COVID Symptom Tracker app. So hospitalizations are probably going to carry on increasing for another couple of weeks. And then I do expect them to decline in the UK, which you can check on the COVID Symptom Tracker app data. Now, I wasn't going to mention this because it's a bit outside the remit of sort of the more sciencey medical stuff that we try and do on this channel. But anyway, well, obviously I'm mentioning it now. So it's just related to selling shares. I mean, I'm just so deeply uncomfortable about this. And this Dr. Albert Bourla, some big boss in Pfizer. But when they announced the 90% success rates, he sold $5.6 million worth of shares, £4.2 million. You know, it's just these amounts of money are money that you and me put together, but almost certainly aren't going to earn in several lifetimes. You know, these are just crazy amounts of money, and you know, we're basically entrusting the future of aspects of humanity to these groups, and I'm just, I don't know about you, I'm just deeply uncomfortable with it. I mean, I'm not on the far left or anything by any means, but I'm just uncomfortable with this, as I've said. Now, to be fair, this boss of Pfizer, apparently he'd agreed that the shares were taken on and they were automatically sold on a particular day when the price reached when the price reached a particular amount. But I assume that would be subject to a manual override. But I'll let you make your mind up about that. I'm uncomfortable. This person is a direct quote. These are all from popular press. That one's from The Guardian, that one's from The Telegraph. Pfizer's executive vice president also sold shares worth about $1.8 million. I mean, again, fantastic amounts of money. You know, and these people presumably are better informed about the nature of Pfizer and the nature of the vaccine than I am, one would assume. And it's not just that. I mean, we had this case in the UK that the very chief scientific officer, Sir Patrick Vallance, sold £5 million worth of shares in GlaxoSmithKline. I mean, £5 million, and he's still got huge amounts of money, or what to me is huge amounts of money, in GlaxoSmithKline shares. And he's supposed to be, well, as far as we know, he is the completely independent chief scientific officer. But you know, I'm sure virtually everyone watching. Well, I'm sure everyone watching this channel is honest. But let me ask you: Would £5 million, $6-7 million potentially influence your opinion? I'd like to think it wouldn't influence mine, but you know, it's a lot of money. It's more money than we'll earn in our lifetime. You know, I'm just very. Yeah, you've got the message. I'm uncomfortable. Right now. Practical things. Now, the Centre for Disease Control is very reticent to declare things officially. And when it gets onto the website, it's normally pretty good. I remember things that they've put on and taken off in the past. So this is for the Centre for Disease Control, published on the 10th of November. And this is to do with mask wearing. And basically they have concluded, definitively really, because it's now on their website, that wearing a mask protects the wearer as well as protecting those around the wearer. Now I'm going to go through this because it's immensely important, and let me show you why it's important. That's why it's important. That graph explains why this is important, and then we'll be looking at some implications of it later on. So just a quick run through this. Community use of cloth masks. So what they're advocating are these kind of homemade, double-layered. That's just one of my shopping masks. Double-layered cloth masks. There fits out. So that. And what they're saying is that these are just as effective as these hospital. Got this from the hospital yesterday. Style masks. So they're saying they're basically equally effective. Now, depends on the nature of the material and everything, but 2 or 3 layers cloth masks are good. So the virus is spread, cough, sneeze, sing, talk or breathe. All of those, particularly coughing, sneezing, singing and talking loudly. Louder talking spreading out more particles than quieter talking. Sorry, right. Non-valved. So we don't want a valve in them. So we're not breathing things out through a valve. Yeah, we don't want that. Asymptomatic or pre-symptomatic, more than 50% of transmission. So most of this virus is spread in the air, droplets and aerosols, from people that are without symptoms or yet to develop symptoms. Vitally, people that are ill must isolate themselves. But that's where it's saying that most of the spread is coming from. So this is the big thing. Masks also reduce inhalation of droplets by the wearer. So this is true, but they're going to elaborate on this. Filtration for personal protection is offered, and filtration and blockage of droplets can be 80%. Now that is based on data on droplets that the person is giving out, but they're now going to comment, and for the first time definitively, on the protection that the wearer gets as well. And what we're going to see is that the two are a double whammy, a very positive double whammy, what we would call a synergistically beneficial effect. Reduce the wearer's exposure to infectious droplets, so this is the wearer now being protected, definitively saying. Includes fine droplets and particles of less than 10 microns, the smaller aerosolized type particles. Multiple layers of cloth with higher thread counts are good. Simple make at home masks. Filtering nearly 50% of fine particles, even down to the size of 1 micrometer, the very small aerosolized particles. Now, they don't say so in this particular paper, but it's vital to combine this with good ventilation, because the lower you can lower the viral load with good ventilation, the better. And we're still not getting this right in many, many places. You know, what gets me about this mask thing is it's the data's here now. We know how beneficial it is. Why didn't the infectious diseases doctors know this back in January? What have they been doing for the past 50 years? You know, really, you'd think all this would have been worked out. It's strange that we're just working it out now. And leading infectious disease doctors, you know, but back in February, March, saying masks weren't helpful. Why didn't they know this? I mean, what could be more basic than wearing masks? You know, I wore them when I started working in theatre in 1980, whatever it was, 1980 actually. So, you know, why wasn't this known? It just seems bizarre to me. Anyway, going on with what the CDC are saying. Human studies of masking and SARS coronavirus 2. Now, they give some examples here. So there was 2 symptomatically ill hairstylists. Now, these people were showing symptoms, so clearly they shouldn't have been cutting hair or whatever they do, but they were. 15-minute appointments, 139 clients over an 8-day period. 67 clients we got data from, so most of them didn't get data from. And there was no infections. So even though they'd done everything wrong and were cutting hair when they were symptomatic, because both were wearing masks, there was no infections. I mean, wow, that is just incredible. Because they had a universal mask wearing policy. Thailand, 1,000 people, always wore masks during high risk exposures, 70% reduction in infections. 70% reduction in infections from Thai data. And that is consistent with the Theodore Roosevelt, it's an aircraft carrier, wasn't it, I'm sure, where there was an outbreak. And again, the Navy found a 70% reduction in risk by wearing masks. And in-flight transmission, also wearing masks and changing masks during the flights. Flying has become much safer. But there again, the airlines have also upped their game on filtration, air filtration. Now, that was so individual studies there from Thailand, the hairdressers and Theodore Roosevelt, but also community level studies. Germany, Arizona, other states and hospitals have instigated policies, and there's been improvements. Following directives from leadership for universal masking. So these have caused improvements. New infections fell significantly. 200 countries, including the US, demonstrate reductions in mortality. So importantly, not only are we saying here that there's less infections, they're also saying there's less deaths. We presume this is due to the lower viral load. Therefore, people are getting less severe infections. Now, in the US, increased mask wearing by 15% could mean lockdown situations were not required and reduce associated loss to the economy of $1,000 billion. So, let me say to the United States, would you like to save $1,000 billion? Fine, increase your mask wearing by 15%. It's just so simple, isn't it? Why didn't people know this before? I'm going to come back to that, I think, in a minute. So conclusions from this. Source control. So in other words, potentially infected people need to wear masks. And personal protection, non-infected people need to wear masks. Likely complementary and possibly synergistic effect. So in other words, what this is saying is if potentially infected people wear masks and people that are not infected wear masks, then the effect of that is It's not like 2 + 2 = 4, it's 2 + 2 = 8 or something. It's a synergistic effect. You get massively reduced transmission if the person with the infection and the person without the infection both wear masks. Now, just to give one example from the United States, because we've been thinking about the states today, Governor Kim Reynolds in Iowa has mask requirements for large public gatherings. She has now announced that this should be done. She now requires masks for indoor gatherings of more than 25 people. So indoor gatherings of more than 25 people should now wear masks, according to Governor Reynolds, and outdoor gatherings of more than 100. I mean, is this supposed to be a joke? This is just, everyone should be wearing masks. You know, you go to an indoor meeting, there's only 24 people there, Governor Reynolds, so you don't need to wear a mask. Is that seriously what you're saying? You know, this is just... I'm not picking her out particularly. It's just one that was on in the popular news outlets. But dear me, you know, we need to be wearing masks in all public places all the time, especially indoors. And just to say there's more than 25 people indoors is just ridiculous. Now, I must confess that I do know what political party Governor Reynolds belongs to, but it does not influencing my... You know, it's just tragic that it's become a political issue in the States. Anyway, the governor rightly says Iowa is open for business and we intend to keep it that way. Fair enough, that's her job. That's why it's time for these additional mitigation measures. So we can keep Iowa open for business by mask wearing if there's more than 25 people indoors and 100 outdoors. I mean, talk about logical non sequiturs. Healthcare system at risk of reaching capacity in Iowa, 200% increase in cases in the past 2 weeks in Iowa. Now, the point I'm trying to make is, if you would like Iowa to remain open for business, and business is largely about making and saving money, then why not have your share of the $1 trillion that could be saved by increasing mask wearing? So basically the CDC has given us definitive guidelines, time to do it, and if there's 24 of you indoors, I would advise wearing masks. If there's two indoors, I would advise wearing masks, of course. Now, I do like to talk about things that have gone well and things that have gone badly, but I'm not... It just happens I've got a few things that haven't gone too well today in the States. And another one that hasn't gone well really is prisons. I mean, Texas is one of the worst. Texas and Florida seem to be the worst. Texas, 41,000 infections, 187 deaths, mostly inmates, not entirely, I don't think. Florida, Michigan's improved a bit now. Ohio, New Jersey, all had significant outbreaks in prisons. Now, we talked about this on this channel back in February, and it was just so obviously going to happen, and it's just a pity. Let's hope they learn from the new guidance, for example, from the Centers for Disease Control on mask wearing, just for example, and ventilation, and whatever measures. Well, I'm not there. You know, the people on the ground need to work this out. This is why you're supposed to have intelligence. Intelligence is the ability to adapt to new situations, but it hasn't been done particularly well in many prisons. Right, last thing today, this new idea of travel bubbles. Singapore and Hong Kong look like they're having one, so you can go from Singapore to Hong Kong and Hong Kong to Singapore without quarantining. Because bear in mind, Hong Kong has barred all residents since March, or non-residents since March. Passengers must test negative and use designated flights. But Kiwis can now go to Australia, I think, or we'll be able to soon. But Aussies can't go to NZ. But it just shows that the Australian authorities seem happy with the situation in New Zealand. So that's probably going to see more of that in the countries that have done well. Taiwan, for example, has done particularly well. Now, when I mentioned the Moderna vaccine, where the information's coming out soon, What I haven't heard about that is how that's going to be distributed. But the Oxford AstraZeneca vaccine, it looks like that's going to be manufactured in quite a few places around the world. So it could well be that most people around the world are going to get the AstraZeneca vaccine. But we are keeping an eye on that, because one thing that I am very passionate about is this vaccine needs to be made available to everyone all around the world. So a few things to think about there. A lot of it really quite simple. Hands, face, space, ventilation. All the basic public health measures that are so simple that we all know about now. And maintain good nutrition to keep the immune system in good shape. So I was lucky. I managed to get my flu jab from work yesterday, so I've got a sore arm now. But that's good. So never let it be said I wouldn't be vaccinated, and I'm looking forward to having the COVID-19 vaccine, and may even take part in the distribution, hopefully. So anyway, that's us for today. Thank you for watching, as always.